Elizabeth, thank you very much indeed for joining me on this podcast, which is something that we thought to do together as part of the cancer strategy. So, I suppose my first couple of questions are going to be a little bit about you and a little bit about the strategy. And you have quite a varied role because you're chief oncologist, but you're also one of the principal people leading on the strategy. Tell me a little bit about you and your role.
Well, thank you very much, Tim, for having me this afternoon. Well, my name is Elizabeth Gomes dos Santos. I'm a South African born Portuguese, Portuguese parents. So I started my studies in South Africa, then moved to Portugal, have worked in other different parts of the world, and have been here in Jersey for the last 4.5 years. I'm dedicated to oncology, have always been. Always wanted to be a doctor since I was small, had no doubt about that. And since about 15, I wanted to be an oncologist. Unfortunately, due to cancer in the family, I've had a lot of contact with oncology even before I started medical school. So I was very fortunate to have met an incredible oncologist when I was finishing school. And I realized that that is exactly what I wanted to be. So there was no doubt in my mind regarding where I was going in terms of being a doctor and being an oncologist. I'm really passionate about trying to improve what we do for cancer patients and their family. And that is really always my aim, not only on the day to day, but when I'm trying to look at how to improve things for our patients. So it's been a passion, it's a huge drive, and that has taken me in different places in the world to try and improve cancer services. And currently, I'm actually doing a doctorate, a PhD, once again, trying to see how you take a step back and work with experts and people that are key in the area. How can we improve things for our cancer patients? So it's a continuous drive I have and a passion to try and improve things for our patients.
And I'm really interested in how that early years, your breadth and depth of experience has shaped a cancer strategy. But perhaps maybe if we start, why do we need a strategy?
Well, what is a strategy? Really, a strategy is a plan. A strategy is a roadmap. Where are we? Where do we want to go? What do we need to do to get there? So it's looking at it as if we're going on a road trip. This is where we are. We know where we want to get to. So what do we need? Firstly, what do we need to pack in the car to make sure that we get there? And then where do we need to be in the next year? Where do we need to be in the next 2 years? So just as a road trip, looking at what do you need to start off with. You obviously first make sure you have a car, make sure that you filled the tank, make sure that you have snacks for the trip, make sure that you've packed clothes, and then you try and understand to be able to get 200 kilometers down the line. What do you need if you want to go further? And that's really what it is. You have to look at the strategy as exactly that. It is a plan for all of us in Jersey to improve how we tackle cancer, looking at it from prevention to cure to living with cancer. It's got to do with bringing all of this together to fight cancer more effectively, ensuring that everyone has access to the best care possible, and supporting patients and their family throughout the journey. And it's really just that. It's a roadmap, getting all the inputs, looking at where we want to go, and then try and steer us on the right direction.
And that's a great metaphor, the idea of a journey and everyone going together on that trip. And I'm really interested, given your past experience, both in terms of study, but also in terms of the jurisdictions and the environments of which you've worked. I'm really interested what you bring when you look at Jersey's strategic needs compared to your experiences in other jurisdictions. You talk about packing the car for a journey. We're Jersey. What's in our car? What do we need in Jersey? And what have you learnt from those other places where you have worked that will be really useful here?
Well, one thing is I've worked in completely diverse settings. Many of the things are very similar. The similar problems, the similar in terms of what does a patient want, what does their family need, what we want to achieve. It's all very similar. But there are then these unique needs that is related to where we live and where we are. So I've been in areas, remote areas. I've been in the Caribbean, also island that's far away from the mainland. So that component in terms of us being on an island
Mhm.
and having to fly out is something that is very important to take into consideration when looking at our strategy. And
Mhm.
if we're trying to improve the patient and the family experience and what they need, that is obviously key in looking at how to improve. Then when we look at the basics in terms of how can we reduce our cancer risks, um, that is important because of where we live. We live on an island. The population is very outgoing. They like to be out on the beach and walking and running. So we have to take that into account in terms of the sun exposure, traveling. Majority of the people on the island like to travel. So the sun risks are extremely important. Then obviously we have to look at the culture. So it's very similar to other places, but in terms of smoking and drinking. So it's looking at how we can reduce those risk factors in terms of a healthier lifestyle. So we have to always adapt to the local culture and to the local customs. But looking at terms of catching cancer earlier, using the best treatments, once again, we have to be mindful that we are on an island. How do we get the best treatments on island? There are many things we can do on island, but there are certain things we can't. For example, radiotherapy, certain expert surgeries. Patients will have to travel off island and the family and the disruption this takes. So it's looking at how can we improve that part. And then how can we support the community? In terms of the local community and the fact that patients need to go off island for treatment. This isn't reality in most places, in the mainland or in Europe or in America. So it's understanding how can we support our patients and their family. And the strategy has to look at the off-island component, which is a big part of it, and how to improve locally in a small island. A population of 100,000, we also have to look at the financial component and what makes sense to bring on island and what can we do. So that is all things that need to be put into a strategy, taking into consideration the culture, the diverse culture as well. It's important because we have people that are from England, we have people from Europe, Portuguese, Polish. So that also needs to be taken into account, especially when we're trying to reduce cancer risks and we're trying to make sure that patients come in for early diagnosis, that they're adhered to screening. We have to adapt to the different cultures that all live within this island, because if this is a strategy for the whole community, we need to take that into account as well. So it's looking at those components when we're looking at the strategy as well.
And I'm really interested in what you were saying there about community, because of course this strategy is not a government strategy. It is
No.
a strategy that encompasses many organizations. Could you just outline for us the breadth of organizations that are involved and participating in this strategy?
And that is very key. The strategy belongs to the community and belongs to the islanders. It is not a hospital strategy. It's not a government strategy. It's a strategy for everyone. So we made sure to have everybody involved. We made sure to go out to the patients, made sure to go out to their family, because that's key, because we wanted to make sure that this strategy was not a piece of paper that was developed in an office somewhere. It was with listening to everybody. So by starting with the committee for the strategy, we made sure to reach out to patients and family who wanted to be part of the board. And our first meeting was out in the town hall asking any patient that wanted to come and speak with us and their family members. So we first listened to the family, and then we made sure that we spoke to everyone. We had various interactions where we invited people to come, obviously healthcare professionals, everybody, doctors, nurses in the hospital, from the GP services. Then we made sure to invite everybody in the community that supported cancer patients, so all the charities or everybody in the third sector, and listen to them. The meetings we had no agenda. It was open. We asked by different types of tumor sites. So we had meetings around breast cancer, around colon cancer, around lung cancer. And we got everybody just to tell us what they thought was working well, what they thought wasn't working well, what the patients needed, patients telling us directly or through their family or through the health workers telling us what they felt that the patients needed, not what we felt we should be doing. So when we started, it became very, very obvious that there was so much support out in the community that we weren't always aware of. The hospital isn't aware of what GP services are doing. GP services aren't aware of what certain charities are doing. So it was important that we got everybody together and that everybody had their part in this strategy. And we immediately realized that Macmillan was key. They were offering so much of the support, and it would make sense that we did the strategy, a co-production with Macmillan. So it was one of the first strategies, health strategies that was done with somebody in the third sector, with Macmillan. And then we made sure to give voice to all of the charities. It's important, cancer relief, making sure we listen to the patients and the family members. So this is, and what's important, we wanted the strategy to be a live document that was always listening, that even when we weren't able to speak to everybody, or they didn't send us an email, or they didn't send us a note, as we're moving along, we're always open to hearing anybody that has anything, feedback that would want to support us, support the strategy and help the strategy. And we also feel that the strategy is changing as we're moving along because of all the input and the feedback from everybody. So certain ideas that we thought a year ago has changed because we've listened to everybody. It's a network of communication and listening to everybody involved in supporting cancer patients and their families.
And I really get that sense of coordination and collaboration and working together. And as I understand it, we're now moving towards, not quite, but towards the end of the first year. What are the key things that you have been able to achieve through this collaboration, through this strategy? What are the key things that you would look back on this first year?
So the most important deliverable this year, which has been really incredible in terms of what it brings to the patient, is our collaboration project with Macmillan for the holistic needs assessment. So it was key that we offered something to our patients and the family members that really was a wraparound service for all their needs. Mm-hmm. We were obviously looking at how do we diagnose earlier, how do we treat better, how can we improve going off island. But these are only part components. What was really important is that somebody sat down with the patient and the family member and asked each single patient, what do you need? What is the biggest problem at the moment? Because obviously, if you come into the hospital, we're looking at one component and trying to improve that. When you go to the GP, they're looking at a different component. But we wanted to make sure that we were actually evaluating every single patient and making sure that we personalize the plan towards them. At the hospital, we were not able to do that, nor is it the right place to do that. Macmillan was able to offer the service. And so together we've forged a partnership. And every single patient on island currently is offered a holistic needs assessment. It is a very complete, comprehensive assessment of the patient. Do they talk about everything from psychological needs, from social needs, from financial needs, and even something that might be related to the treatment or something they're not aware of, all of that gets factored into this plan that is then put in place for that patient, and looking at everything that they might need and making sure that they put into contact with all the supports there are in the system within the island. So that was really was probably one of the most important deliverables of the strategy, and we've been able to put that in motion, and it is now, as I say, offered to every single patient that is newly diagnosed. And that is really something that we are all very proud of and hope it will really impact the patient and the family. One of the other deliverables that was extremely important is actually noting all the services there are on island. So we were able to make sure that we have a directory of all services on island, and making this directory and putting it all together was really eye-opening, because we found so many, even certain charities and certain agencies that were supporting that, as I said, we didn't realize. And it was just incredible putting it all together under one directory. And that is also growing. We're always reviewing it, adding on information, but just putting all the information, what there is, how to contact them. And then it's given to the patient. It's any nurse that interacts with the patient, or the GP services, they have that directory. It's also online so that you can look, and the patient can also look and see, well, I need something in this area. Let me see what can help me resolve this situation. So that component about bringing everybody together and giving a wraparound service to our patients is really probably the highlight of this year, and of which we are very, very proud. We've been able to do a little bit more during this year that has also been part of the strategy, and due to the strategy, we've been able to push part of the digitalization of our oncology department. That's very key. So we've moved some of these projects forward. There are more to come, but we've been able to do two very good projects that really will help the efficiency of how we treat patients and move the patients through the system. So that has been key. Another part, concentrating again on the patient, obviously the importance about diagnosing, treating, getting patients through that component, and then living with cancer. So we've been able to have the survivorship clinic. We've grown the survivorship clinic. This has also been a collaboration project with HCS and with the oncology department and Macmillan, make sure that every single patient, when they finish their treatment, has support and guidance in terms of how to reintegrate into the new normal, be it in terms of going back to work, the family situation, and just trying to guide people in terms of the supports going back into their new phase in their lives. So that has been important, and we're making sure that we can grow that to offer more services. So that has been key. And another component in terms of screening, we've realized that patients are aware of screening projects and the screening programs, and they know they should be screened, but it shouldn't be up to the patient always, although there is that responsibility to know when they have to be screened, because everybody's busy, everybody is interacting with their family and their work, and they don't always remember. And one of the things from the strategies, we realized that the system for the majority of the screening was what we call opt-in. So patients knew that if they were 50, for example, a woman knew from 50 years on, they could be contacted to have, they could contact us and we'd register them for a mammogram, a screening for breast cancer. But we realized that we were not getting through to all of the patients that, or all of the people, women that were eligible for breast cancer. So we had to change the pathway and how we do it. We had to make sure that we contacted every single person on island that is eligible for screening, be it cervical screening, be it for colon cancer screening or for breast cancer screening. So firstly, we had to make sure that we're able to contact everybody. But if you contact everybody, you also have to make sure that you can then offer the service of screening. So we then realized, because we were not offering the service to all the patients, or all the patients weren't coming to us, we had to improve first, having another mammogram on island before we could offer it to everybody. And so that is just a project that's gone live, making sure we have another mammogram. And how were we able to do that? Through the hospital, through the health services, through private monies, through a private bond, and through charity. Especially Cancer Relief, once again, stepped up to support, making sure that everybody together were able to put the service in place. And now every single woman that turns 50 on island will be contacted to come in for a mammogram. So it doesn't depend on a person being mindful, because there can be also issues with communication, as we've just discussed. We have a vast array of people on island. English might not be their first language. They might not be reading newspapers or seeing things online. So this way, we'll make sure, apart from the messages getting out through all these different forums, we will be writing a letter to every single person for them to come in, so that we can diagnose early, and then we can, when needed, be able to start treatment when necessary.
Well, you certainly achieved a lot, and I know that there are a lot of organisations involved, not just those that you've mentioned, but you do interface with other government departments to see if we can smooth the way for patients and their challenges. So, a pretty fantastic first year, but it's a strategy. It's more than 1 year. What are your aspirations going forward? What happens next? What is the ultimate goal?
So firstly, obviously, looking at our main objective always, and why the strategy is called together, is working together. So it's building on our relationships and network. Local government has a fantastic platform for all of us, the Cancer Network, that meets regularly every 6 weeks, where everybody related to any cancer service or cancer support is able to meet, talk to each other, discuss things that are working well within their departments and in their agencies, and what do they need, what do they hear from the patients, how can we support each other. And as you say, we've been able to do a lot of work around social services, supporting our patients, and thinking and looking out of the box, because if we're not talking to each other, we don't understand what our patients need. And if we then understand what our patients need, we can then together come up with the best plan and who is the best person to support under the conditions. So there's been that platform that has really been great for us to openly speak with each other, and look at solutions. But then going outside of these meetings and continuing the conversation, and we have the charities leading on this, where they're looking at what do the patients need and how can all of us support them. So we're looking forward to furthering those projects specific. So in 2025, we really want to be looking again at a collaboration project between all the charities and health services and GPs, to see what do the patients need, how can we improve it, like we did with holistic needs assessment. Then we're also looking at continuing the digitalization of the services. Once again, communication is very important, how the GPs speak to the hospital, how we speak back to the GPs, making sure that that is smooth, and we support the GPs more, and the GPs reach out to us at the hospital easier. Everything to make sure that we improve the diagnosis for the patient. So we're looking forward to improving that, working together. So it really comes all down to collaboration and how can we improve services. There's big changes with digitalization, the use of newer technologies through AI that can support our different departments, such as support radiology, support pathology. So making sure that we are on track and part of these new developments. And then very important component is the new treatments. There is so many new treatments and changes going on in terms of what we can offer our patients. So it's making sure that we are on top of all this information, and then making sure that we can bring it on island, and looking at the affordability and how we need to budget for these newer treatments, that although they might be more expensive in terms of what they can give our patients, is so much more than the traditional treatments. So it's making sure that we're aware of the treatments, that hospital is aware, that government is aware, and understanding that we make budgets taking all of this into consideration, and then talking to government and talking to the community to discuss these new treatments, the prices of these new treatments, and how we can make sure that we can offer them to our patients.
And I'm really interested in sort of the future, both the near future, what we plan to do next year, but also the far future, because you talk about digitalization, you talk about AI, you talk about all the new products and services that were unimaginable 10 years ago and now are coming online, particularly new drugs and the like. I mean, Jersey must have quite a complex situation because, of course, we're not a huge economy. We don't necessarily have all the resources to do everything locally. So we're definitely part of a global network, but we definitely have local needs. And I'm wondering, what are the challenges of harnessing the value of things like AI or the new pharmacy? Because presumably you still need really close alliances with the NHS or indeed other European countries to have access to these services. So I'm just really interested in that aspect.
Well, the opportunities are just incredible, of how we can use the new digital tools and AI. It is changing all aspects of our life on the day to day. It's part of it today already. And as we know, it's just growing exponentially. And so we have to be a part of it. The island has to go with these changes. And the quicker we're on board with these changes, the better, because there is a lot that we can gain. Obviously, there's always a negative component of all um, new ideas and new solutions. And it's been part of that collaboration and the discussion of all of these that's important, because as you say, we're a small community, closed community, which is also good for certain things, the digital and the AI, because we can control it better. But we also have to be part of the bigger conversation, obviously, mostly with the UK and with NHS and with the health services there. So much is happening, and it's happening at such a fast pace. Beforehand, 15, 20 years ago, we'd be looking at new treatments or new developments, and we'd have at least 2 years to try and bring that into our practice. Now we have 3, 4 months, and you have to bring it into our practice because the changes are just so big, and so fast moving, and our patients demand it. Our patients are aware of changes, and this is where the digital tools and the AI can make a huge difference, because they can make certain components of the pathway much more efficient. They can support the health workers, and they can support patients as well. So it's making sure we are on board, looking at what will work for us, and using all of this to our advantage to make our lives easier as well. With the changes in treatment, and the changes that have got to do with the fact that we're living longer, we're surviving diseases. We know next week the cancer report for the Channel Island comes out. Incidence is going up, we know that. more and more patients are diagnosed with cancer. Majority of it has got to do with the fact that we are surviving diseases that we didn't survive before: heart attacks, strokes, sepsis. We are surviving those diseases, and we are surviving cancers. So we're living longer. So we know the incidence is going up. Patients with cancers are surviving longer. So there is more and more patients, more and more work. Unfortunately, the workforce is not able to ensure that all these services can be offered to patients. So we see in the UK, we see in Europe, in USA, everywhere, there isn't enough specialists in cancer services. There isn't enough oncologists, nurses. And as all of the cases are going up, we need these new technologies to support us, to make things more efficient, to make it easier for us to be able to deal with a patient, so that there isn't delays in diagnosis, delays in treatment, as we've seen in countries like the UK and in Europe. And so we have to be one step ahead to make sure we can use AI, use digital tools to support us in making decisions about treatments, about diagnosing, and making things easier, because humans take time to complete tasks, and computers can do it faster with oversight from physicians. This year, many of the physician associations have come out with a statement that's very true, in terms of AI will not substitute doctors, but doctors that don't use AI will be substituted. Because at this moment, we have to use these digital tools to be more efficient, to be able to get to answers quicker. And if you're not using it, then you then slowing down the system. So it is a big change, and things are changing daily. So it is very interesting time to be involved also in healthcare, and looking at how we can adapt, making sure that the information is safe, because we really have to share information between all of us. We have to share with the GPs, we have to share with UK hospitals in a much quicker way. It can't be letters anymore. We have to be sending data up and down quicker, so that the patient can gain from it quicker, and then making sure to keep that safe. And now with AI and blockchain, those ways of making sure to keep the data safe is just becoming easier. And so it's taking that advantage of that. So we're able to share information of patients between who it needs to be shared quicker, and to the advantage of the patient.
And I'm really interested, an awful lot of what you've said, particularly around data is and digitalization, is about screening and about care. But you also talk about this idea of partnership and sharing data. And I'm wondering to what extent people's attitudes towards their own health, their own well-being, their own responsibility for themselves have changed. I fancy there are a lot less smokers now than there were in, say, the 1970s. And I think hopefully we're much more aware of the needs to wear sunscreen. But what increasingly do you see that we need to change, or we need to continue with the population, with people like me and my friends? What should we be doing more of as our part in the cancer strategy?
That is important, because it is really up to each and every one of us. We know the statistics, they are very stark. 1 in 2 people living in Jersey or in UK will have cancer during their lifetime. So there is no way that you won't be affected by cancer during your lifetime, be it yourself, your family member, your neighbor, your co-worker. Everybody's affected by it. And you say that supposedly we are smoking less, and we're more careful with putting on sunscreen, but we aren't as careful as we should be. And so definitely each person has to be taking more responsibility for their health, for decisions, also being informed and understanding what we've learned. And we have to make sure that we also get that information out there in a way that makes sense. for somebody in their 70s that might not, that still reads a newspaper, and get the same message across to the 18-year-old that only looks at TikTok videos. We have to take that all into consideration. But what is important is each person has to take responsibility. And I think before, even when I started medical school in the 90s, it was very much the doctor made the decisions, the doctor knows best. I just need to go in and listen. It's not like that anymore. The patient, society have to be aware of what's going on. They're part of the decision making. They also have to be informed and be informed. Obviously, there are so many places to get information, but also making sure we guide patients and the community to get information in the right places, so that they can also make decisions with information about their own health. And so being much more involved, using the new digital applications as well. So many people have a smartwatch. All that information is so important, and allowing data to move between healthcare professionals can really make a difference. Because if your smartphone data goes to your GP, he can actually, when you go in to see him, he can say, there's been some changes. Yeah, I see you're exercising more, or your blood pressure's been a little bit higher than it should be. This is an incredible way of monitoring health, and that we really need to take more advantage of, because all the data is there. We just need to harness it and put it all together for the betterment of the society and the community, and then to support, being able to support in a better way. We all know that people that want to stop smoking, that there is support, but maybe it's not as easy, taking afternoon off or actually going to speak to somebody. It's how can we use the new digital and AI to help with making those decisions of drinking less, stopping to drink, instead of having to go in to see somebody and discuss. Maybe there's so many other solutions, but it is once again comes down to communication, talking about it, information, being out there, making sure that we're all listening and looking at what is best for me, for my family, because everybody can make a difference, and everybody can contribute not only to their own health, but to a friends, to neighbors, to a family members' health.
I'm really interested in the connection between your general health, physical and mental health, and cancer, because we've all heard those stories where somebody's super fit and they get cancer, but they were so fit and healthy. And equally, we hear stories of somebody who smoked 20 cigarettes a day and were fit as a fiddle and died without any sign of cancer. I mean, how do we tackle these stories? How true are they? How important is just being generally healthy?
Well, the most important part is genetics plays a big component in it. And although we know there are a lot of cancers that we could reduce the risk, we cannot decrease the incidence of cancer. That is just unfortunately what it is. Every single day, we have cells in our body that are dividing and replicating. And every single day, when they are dividing and replicating, they make errors. And then those errors have to be fixed by our immune system that walks through the body, fixing it. But sometimes, and as you get older, we aren't able to fix those errors. And what happens is, what a cancer cell is a cell that has an error in its DNA that has not been fixed. And so this cell then is able to find a way to survive and live, and it doesn't die. And that is what a cancer is. It's a cell that keeps on living, doesn't die. Another cell makes more cells and keeps growing. Then it needs more oxygen, it needs more nutrients, and then it goes into circulation and tries to find other parts of the body where it can grow. So that component of the fact that there's a change in the DNA of the cell, and that the cell, those things are always going to happen. and we can't stop that at the moment. We can't, and there's nothing you can do. Being healthier or less healthier, those things are going to happen, and so that is important. This concept of, I've done everything I can. I'm healthy. I don't smoke. I don't drink. So the chances of me having cancer are very low. Unfortunately, that's not true. But we do know that there is a big component, a big part, between 30 and 40% of cancers that are due to factors that we can change. And obviously, smoking, excessive drinking, not being active, diet in terms of a lot of processed food. We know that there is a lot of, and obviously the sun and not being careful with tanning beds, etc. So there is a component, and that's important to look at. But apart from that, if you are healthy and you don't smoke and you don't drink, unfortunately, that is not enough. And that is why you have to be attentive to making sure you do the screenings, any symptoms out of the ordinary, to go to the GP so the GP can look at if it's necessary to do further testing. Because the biggest factor that will be able to impact on the cancer is if we diagnose it earlier. Any cancer diagnosed in its early stages is curable. Cancers after a certain stage are not curable. We can try and control it and improve quality of life. So the key is early diagnosis. So patients, so we have two groups that always worry us. That's the patients that are very healthy and feel that they don't need to worry about screening and making young patients, because unfortunately cancer occurs also in younger patients that don't value their symptoms. And then some of the older patients that have a lot of diseases, what we call comorbidity. So they have diabetes, they have hypertension, they might have some chronic lung disease, and then don't value their symptoms either. Then it's difficult to diagnose early. And then if older patient with a lot of comorbidities is then diagnosed with an advanced cancer, our hands are tied in what we can offer. So it's that concept of, and there is, we can decrease our risk with certain attitudes and doing certain things, but unfortunately that is not enough. You will still always be at risk of cancer. Some people more than others due to their genetic background. Some of them is known due to family history. Others changes in genetics that you won't be aware of that will have impact in you having cancer. So it is being informed, being attentive, and trying, most importantly, to die earlier.
Well, I have to say, I've done a few podcasts, but I don't think I've ever done one that's quite so important in terms of life-changing or even life-saving. So I would really encourage anyone who watches this to follow that advice because, as you say, you can be fit and healthy, you should still get screened.
Yes, it is so important to just be involved, stay informed, participate in screening, speak to your neighbor, listen to them, and then also give feedback. Let us know what information you need. We did a reach out to the college here, and it was interesting that 20-year-olds were telling us nobody tells us what to do at this stage. How can give us more information? We don't feel that we are getting the information. We need to make wise decisions now regarding cancer. Unless we have a family member with cancer, we don't really think about it. And so there has to be ways that we have to listen and get the information out. But it's all the information and then giving the feedback, and speaking to your family, to the GP, when you interact with doctors or nurses at the hospital. It's just making sure, the strategy belongs to all of us, and only together can we improve the cancer outcomes and the so-called burden of cancer in terms of the financial burden. Because everything, if we can switch when we diagnose patients to much earlier, not only obviously does that impact the patient, the family, the quality of life, but also in terms of the burden, a financial burden, it changes completely. So it becomes we're able to then manage this increasing number of cancers, and it's sustainable with the newer treatments and the newer options we have.
And given your breadth of experience in other jurisdictions, how does Jersey shape up and compare? I mean, you've already given a little bit of a hint. We are a sunnier climate. We possibly do more outdoorsy type stuff than perhaps other islands or jurisdictions. You know, if you were going to give Jersey a health check, what would you say to Jersey as your doctor advice?
I think it's obviously, unfortunately, alcohol and tobacco is still a major issue, maybe too big um, that we would want it to be in terms of we still have a higher incidence of head and neck cancers, lung cancers, which is not acceptable in today's modern society. So we really have to think about um, those lifestyle changes, and obviously also what that implies to governments. Governments, there's a lot of discussion at the moment in the UK where it's not going to become totally illegal to sell tobacco to a certain age group moving forward. Making those decisions has a big financial impact on the current government budget, but it's being able to understand that that commitment will pay off in the future. So it's when we have to help our government and political representatives make that decision easier, because obviously it is difficult to understand where you're going to fetch the money that was involved in the taxing tobacco and alcohol. So that is key, that the society understands the importance of it and supports government in making those decisions. And obviously, we're all under financial strain at the moment. So it is looking at the budgets and looking at that and understanding that sometimes where you put money today, you won't reap benefit in the next year or 2 or 5, but in 10 years or 15 years or 20 years, you will. And so that is an important message to our government and to the politicians, that they have to think long term, and so do we. So we need to understand that there is a cost for health, and we have to understand that sometimes we need to pay up front to then reap benefits in the long term. And so I think Jersey is at a point where they're looking at how the health system works, how to budget to make it sustainable to the future. So Jersey actually is in a unique position to look at where do we need to put the money to make sure that it's sustainable, and that we impact the quality of lives of the patients and the society.
This has been a really fascinating and informative conversation, and it's been really broad. I mean, we've talked about pharmacological products and services. We talked about oncology. We've talked about digitization and AI. We talked about personal accountability and the sheer breadth of organizations that are involved in the strategy. Because as you say, it's not just a government strategy, it's a community strategy. Now, one of the things that we can do with this is share links and information. But if people are really interested from whatever sector, whether they're a pioneer in digital health, or whether there's somebody who has personal health concerns, or indeed are just a volunteer, okay, who are incredibly important, how can people get involved? How can people support the cancer strategy, get in contact with the right people? What can we do to help them be part of that community building a better future?
Well, what's important is that we try and centralize a lot of information, and we're doing that through the cancer.je site to try and get a lot of information there for patients, for family members, for people that are just looking for additional information. So I think that's important. And then just always speaking to, whenever you have an interaction with a health worker is making sure to ask questions. When you go to the GP, when you see the practice nurses, when you come into hospital for an appointment, when you speak to family members, it's just making sure that you interact. You can contact me directly, but always just try and think about how, what part can you do in improving health, your health, family's health? What part can you do in terms of improving cancer outcomes? Importance about the early detection, importance about sunscreen. It's just thinking about these things, and just when you can discussing it, because if we're open about these discussions with family, we might learn something, you might have a question, and to go back and find out about how you can help. But everybody's more than welcome, and we're really open to everybody. Working together, we can really make the strides that we need to do in fighting cancer. And every little step really makes a difference towards where we're going. And we've noticed that our collaboration projects, certain people think they might not be able to offer anything, but they do. Everybody has something that they can offer and makes sense. So it's really been part of the projects. And if you have any interest, just reach out to me or through cancer.je, and we'll make sure to put you on to the different work streams to support.
It's been a delight speaking with you. I am super impressed by the things that you and the community collaboratively have done together. I'm impressed with your vision for the future and what you've already achieved. World Cancer Day is coming up early next year, the 4th of February. I would really look forward to meeting with you again and understanding your plans for 2025. And if they're as successful as what you've achieved in 2024, that is a remarkable thing that we have done together. Elizabeth, thank you very much indeed.
Thank you for your time. Really appreciate it.